Well, let's speak. Okay, we just got a notification that we are recording. Thank you so much, everybody, for joining us. I think most people know me. I'm Peter Werby. I live on Roanoke. This is the East Oak Park Neighborhood Association monthly meeting on Zoom. It's been a long time since we've met in public, and we all are aware why. That's because of this pandemic, which does not seem to leave us. The CDC defines low transmission of the coronavirus as having fewer than 10 cases per 100,000. Today, Oakland County had 112, which is then considered high by the CDC. So many of us are looking and starting to act like we're getting over this, or we're just going to, as a matter of will, just begin to resume our lives like we did before this. That number is actually dropping significantly. On Monday, it was 157 and per 100,000 in Oakland County. And what did I say? It's 112. Now, in 3 days, though, there were 21,000 new cases in Michigan. And let me see here, a total of almost 2 million cases since this has begun. And what's Michigan's population? 9,000, I think it is. So it's a significant factor in our lives. So we're fortunate to have with us tonight Lauren Fink. She's an epidemiologist at the Oakland County Health Division. And she's going to be answering our questions, both ones that we've sent out prior to this meeting and any that may occur to you as we go along. I want to thank Oakland County Commissioner Charlie Cavell. He put us in touch with Lauren and with Jared. So, and as I said, if you have questions as we go along, more voices are good. So I'm just to make sure that we get through all of this, and I'm going to not necessarily go in order. One that I'm wondering about, and I wonder if our two guests even know the answer to this. I asked for a federally provided home testing kit and have not received it yet. And can you speak to any idea of when they will arrive? So Jared, you have to take, yeah, there you go.
Yeah, Lauren, I'll take this one. I too have ordered my test and have not received it. So per the White House, they say that it would ship within 7 to 12 days. And then 1 to 3 days of the actual shipping process. But again, that's not something that is within our hands to control. So.
Okay. And they are available, at least I was able to get them a couple of weeks ago at Rite Aid. They're about $10 a piece. So we got a pack of one, and if you get packs of two, it's double that. If I have symptoms and test negative, how often do I have to repeat test to be sure? I often wonder about that. You know, you see these lines of people, waiting to get tested, and they could be being infected while they're in the line, or they, so what's what kind of schedule, or should there be a schedule for self-testing? Jared or Lauren?
Yeah, I can take this one too, Lauren, if you want me.
Yeah, so, Jared's our testing expert. So
really, it truly does depend on what your pre-test probability is like. So each instance is going to be a little different depending on what is going on. So have you been exposed? Are you fully vaccinated? Are you up to date on your vaccinations? Do you wear a mask when you're exposed? All of those things are going to play a role into your probability of converting to a case of COVID-19. So if you are a symptomatic individual, you've had a negative, let's say a rapid antigen test, because the testing also does matter. If you've had a negative rapid antigen test, but you feel that maybe, you have been exposed and you are symptomatic, it's best to continue isolating and seek a better test, a PCR-based test.
What about the idea just you go out to a restaurant and, that's where a lot of people have been contracting the virus. Does it make sense to come home and use up one of your tests?
I'm not sure what the question is. Immediately after coming from a
Well,
restaurant?
well, what would you do? All right, my wife and I and two other couples go out to a restaurant, and there's other people in there, and should there be any testing protocol after the visit to the restaurant?
If you want to, you can. Yeah, the best time to test would be about 3 to 5 days after. You wouldn't want to do it right away. You'd probably just waste a test.
Mm-hmm.
Um,
Three to
because
5 days.
there's an incubation period, right? So you have to wait for that. If you were exposed and were to convert to a case, hopefully you don't, but if you were, you need to wait for that virus to replicate within you long enough to be detectable.
Okay. There's a lot of talk about masks. I suspect most people know that the N95 and the N95 are the best. Anything to add to that?
When we talk about masks, I always like to emphasize that there's two really important points. One is fit, and the other is filtration. So an N95 or a KN95 has excellent filtration. That means that it's going to keep out a large number of particles. But fit is a really important factor as well. And so if you put a KN95 or an N95 that's designed for an adult, for example, on a tiny child's face, there's going to be a lot of air coming in through the gaps on the sides and on the bottom. The child's not going to have much protection from that mask. So you need a mask that fits well. For example, I have a 4-year-old, and I have her wear a cloth mask because it's a cloth mask with a good filter in it, and that's the mask that fits her best and that covers her whole face, and she'll keep it on all day long. So the other factor, there's fit filtration, and then the best mask is one that you'll actually wear. But assuming that you've got one that's comfortable, it fits you with no gaps, all else being equal, a KN95 or an N95 is your highest quality choice. And then a surgical mask is another great option. Those have great filtration as well. But the surgical masks, and those are the like normal kind of papery disposable ones that you're used to seeing. The issue with those is that they tend, for most people's faces, there's going to be gaps. They're not going to fit very well. There's a couple of little tricks that you can do to make them fit better. One is putting a well-fitting cloth mask on top. So obviously that's going to hold it down on your face better. The other thing you can do is it's called the tie and tuck. And if you Google it, there's a lot of like videos explaining how to do this. And there's CDC has an image as well that you can look at. But you're basically tying the sides and then you tuck in the fabric. So it just makes it fit your face a little bit better. So those are generally our suggestions when it comes to masking. But the most important thing is that a mask fits and that it has a fair amount of filtration. So if it's a cloth mask, you want at least 3 layers of fabric.
Okay. There's circumstances in which our masks come off. If we're at a restaurant, we go in with them and then we take them off. I'm wondering though about gatherings in homes. My wife and I have gotten together with people who are triple vaccinated and who have spent most of the time isolated, and they take the same precautions we do. Of course, they don't know about us and we don't know about them. When can you forego a mask?
So I think it looks like Dawn has a question. I don't know, Peter, if you wanted to take questions or.
I was ignore her. Or no, I wasn't. I didn't see it. What? Oh, there's her hand up. Yeah, go ahead.
Well, all right. So here's the thing. Sam had his hand up before me. So if Sam, you would like to speak before me, you're more than welcome to, because we finally got Peter's attention.
Oh.
I just wanted to say that I ordered tests from the federal government and received them. And I also ordered tests from Amazon and received those. So they are in the pipeline and they are coming our way. And
Okay.
I've been the rich recipient of them.
All right. Yeah, Dawn. I'll look for people's hands.
Yeah,
All right.
please do.
Okay.
Thank you for noticing. Anyway, you had indicated, Lauren, that you put a filter on your child's mask. What is that?
So there are a couple of different options with filters for cloth masks. So there are, cloth masks that have like a pocket in them that you can put a filter in. My daughter uses a type of mask called, and this isn't like an official endorsement or anything. I'm just sharing that my daughter likes a type of mask called a happy mask. They have lots of fun colors, and it has the filter already built in. So that's just the type of mask that we use for her. So there's a lot of different options. A lot of the cloth masks that have filters, they will wear down over time, especially if they're washable. So they're not going to be the same thing as that, high quality N95 or KN95 disposable mask. They're not a replacement for those, but it's just another option if you want something that's sort of in between a normal cloth mask and then an N95 or a KN95.
Following up on the conversation about masks, how many times can you wear them?
Jared, did you want to answer that? I know you did some research.
Yeah, so it's kind of variable. Typically, you can wear a mask until they become soiled or don't fit as well. For healthcare providers, the recommendation is you would get 5 uses out of them. Obviously, they would be wearing respirators as opposed to a mask. And one of the nicer strategies that you can do if you do have access to an N95 or a KN95 or multiple of them is start kind of a rotation between them, where you have one, you're wearing one on one day, the other is stored in a brown paper bag that is a nice environment for that to be kept in. And then you would rotate them until they get soiled or stretched out if you want to prolong the use of the mask. It also does really depend on how long you're wearing them and what you're doing in them. Obviously, if you're going to the gym and you're sweating in your mask, that's going to soil your mask much sooner than 5 days. So I wouldn't recommend that.
And are free masks in the pipeline?
I don't know much about where the free masks are. I've heard that they have been starting to be distributed to specific pharmacies and grocery stores, but I haven't seen them myself.
Okay.
So that's another federal government program.
Yeah. If you're just joining us, did someone say something?
Oh, go ahead. Oh, I was
go ahead.
just going to say, I was going to ask if you wanted us to, while we're on the topic of masks, to come back to your question about when it might be a good time, if there ever is a good time to forego mask wearing.
Sure. Yes, go ahead.
And now that I've offered to answer this question, I realize, as I'm sure Jared would agree, it's a complicated question. And I like to remind folks when they ask me questions as an epidemiologist that there is a point where the science ends and there's still a decision to be made. There are other things that you need to consider, things like your risk tolerance. And that's something that, we can't give you a clear answer because I don't know how comfortable you are with risk. What I can say is that there's a very large gradient of risk. There are certain activities that are going to be much riskier than others. A large wedding of people who some are vaccinated and some are not, and it's indoors. Obviously, this is going to be a very high risk situation as compared to the example that you gave, a small gathering in a home of all fully vaccinated and boosted adults. I think that there are definitely times where a situation like that, you might make the reasonable choice to not ask your guests to wear masks. Some things that you might do to, not right now, but you could open up the windows to improve the airflow. So that can make it a slightly safer environment, using, any other tools that you might have at your disposal to improve the air filtration. So some folks have, standalone air filters that have become a little more readily available, little standalone HEPA filters, as well as you can, maintain distance from each other, keep a fan going to keep the air circulating. But, it's not, but it's not really a scientific question.
I hear you.
So there's not a clear-cut answer. Jared, I don't know if you have anything that you would add.
Yeah, I think you nailed it. It's what is your risk tolerance, and who are you surrounded by? Are you surrounded by individuals that need a little bit of more protection and a little less risk taking? So it's going to be different in everyone's social circles. But obviously having people up to date on their vaccinations, which means 3 doses if you've got the mRNA vaccines, is going to be crucial in preventing transmission and also preventing disease severity if there is transmission that does occur.
Is there a map of infections? I know that on last Sunday night, there was a memorial for a colleague of mine at the Token Lounge in Westland. There's about 500 people there. And I said I wasn't going to go. And sure enough, I looked at the photos of it, and I think I saw one person with a mask. So you had 500 people, and at least 2 of the people I know are not vaccinated that were, going to be there because they're depending on their natural immunity and their good vibes. So, you would say, okay, that's a super spreader event. But do we wind up with 300 positive cases from that, or 3? Is there any way to speculate on that?
Lauren, do you want me to go into that?
I mean, it's always possible to speculate. So
Yeah, and you're right. It would be entirely speculative.
Yeah.
Right now the R naught of Omicron, the replication factor, is thought to be sitting at around 8 to 10. So that's one case would infect 8 to 10 other individuals. So at a large event like that, it all depends on how many people are there, how many sick people are there. Obviously, masks weren't being worn. There's really no way of telling how many people are going to get infected by this because you don't know what the
air circulation.
Yeah, exactly. And so in those scenarios, the best thing to do is to decide, again, getting back to what your personal risk level is. You see that happening and you say, you know what, maybe this event is not for me. I'll attend virtually.
That event was not for me. And everybody said they respected my choice. I think a number of other people didn't go as well. But say I would have gone and suddenly I test positive. What are the quarantine guidelines that should be followed? So, with other people in my house.
yeah, so at this time, our recommendation, if you had tested positive, would be to isolate yourself including from others within your house as much as possible. Obviously, I'm a parent of a young child. I know that can be difficult if you have caregiving responsibilities, but as much as possible, maintaining distance from others in your house, starting on the day that as soon as you get that test result or as soon as you have symptoms, if you do have symptoms after some type of an exposure. Wear a mask if you have to be around others in your home or if you're in shared spaces. You'll want to maintain that level of care for at least 5 days. On day 5, you sort of assess the situation. If you're starting to feel better, if you've had no fever for 24 hours without the use of any fever reducing medication, your other symptoms have improved. You're not coughing and sneezing all over the place. You might be able to start leaving your house, being a little bit more out in the world, but you still want to be cautious. There's a good chance that you've cleared the virus at that point if you're feeling better after 5 days to begin leaving your house on day 6, but it's not guaranteed. Some things that you can do to make extra sure: you could take a test. We would recommend taking a rapid test, not a PCR test. A PCR test might pick up essentially virus that's not really alive or that doesn't indicate that you're actively infectious. So those PCR, those are those lab-based tests that take a while, but those rapid tests, those type that you might do at home, usually is going to indicate whether you're still actively infectious. So if you've tested positive before, that's the one to use if you want to test again. Again, symptoms have improved. Maybe you've had a negative test. You can leave your house on day 6, keep wearing a mask and you want to avoid, being around people who might be high risk, don't go visit your grandma in the nursing home until at least day 11. If on day 5 you're still not feeling so hot, stay home, stay isolated from other people in your household until day 10.
Okay. There used to be an emphasis put on contact tracing. I know when I went to this gym I go to back when it was, this Omicron, it wasn't in full force, or even before Delta, I guess. It was kind of weird. You'd check in, so they knew you were there, but then they wanted you to also check out, and they said it was for contact tracing. That seems to have disappeared as a procedure.
I will mention, I'll touch on that question, but Lorraine Bolkowski, she looks like she has a question as well, if we want to address that.
It's more of a comment than a question.
Thank you, Jared.
What did you say?
I just said thank you, Jared. He's being a better host than I am.
So, and my daughter is married with 2 children. Her husband and the 2 kids were all 3 tested positive. Her husband had classic symptoms. The one son had 104 fever, and the rest of then he was fine that night, and then he tested positive. The other son had 0 symptoms, but he tested positive. And my daughter tested negative, and she's living with them. And then today I heard of another person, he had it, but his wife did not. So is there any explanation for how that can happen when you're immersed in their germs and you still don't get it?
Yeah,
it's
absolutely.
The same way that, oh, sorry, Jerry.
No, Lauren, you go ahead. You go ahead.
I was going to say, I mean, I think that we think about COVID as so different and unique and than other viruses, but I'm sure we've all had the experience of a household member gets a cold and we are somehow miraculously spared from getting the cold, right? Someone in the house has the flu, or maybe chickenpox is a bad example, because if a kid has chickenpox, then any unvaccinated kids are probably going to get chickenpox. But every once in a while someone doesn't, and it's like, okay. Basically immune systems are an incredible thing. Our human bodies are equipped with these wonderful immune systems that are imperfect, but do sometimes protect us even against something that we've never encountered before. It's also possible that they did have a very mild infection that just didn't get picked up on a test. It's possible that they had been exposed to the virus before and never knew it, and so they have some immunity. And of course, if they're vaccinated, it's possible that their vaccine worked. We hear a lot about vaccine breakthrough cases right now, but there is still some efficacy. The vaccines are still effective in some circumstances in protecting people from getting infected at all.
One of the questions here is, what is the new normal going to look like? But let's save that maybe till the end. Someone, one of our members wrote in and said that they've had both vaccines in the booster, and now we hear something about perhaps even a 4th shot. What's your thoughts about those, and how efficacious are the ones that were currently in our system, that are currently in our system?
Did you want to take that, Jared?
Yeah, I can touch on it. So with regards to a 4th dose, that is something that would have to go through what's called the Advisory Committee on Immunization Practices. So that is a recommendation that is given by that advisory committee. So if they feel that it is worth it and that it is needed, then they would make that recommendation. But we'll wait to cross that bridge when it comes, and if it comes. And then as far as how effective the vaccine is against Omicron, it depends on the vaccination that you get, first of all. Obviously, getting boosted helps your odds. It does decrease your risk of hospitalization significantly. And that's kind of the key when we talk about what does the new normal look like. The new normal doesn't always look like preventing any and all cases, because that may not be possible. The new normal is about trying to prevent severe disease. So if we can get people to a level where their bodies are able to, fight off COVID-19 and make it a less severe disease to where they don't need to be hospitalized, that's a good thing. And then obviously throwing in therapeutics with Paxlovid coming to be, it's not readily available right now, but it is in production. So that is going to be another key player along with monoclonal antibodies to reducing disease mortality and morbidity.
Well, some sort of a phrase I hear frequently, oh, we're all going to get it eventually. How do you react to that?
That doesn't necessarily need to be the case. We did see a very, very massive spike, and we're still in the midst of a decline in that massive spike from Omicron. But there are some people that do have that mindset, but not everyone does need to have that mindset. So it gets back to what is your personal risk level. If you're taking more risks, the likelihood of getting COVID increases. If you're taking less risks and being more careful, the likelihood decreases. So you don't necessarily have to be. It's more of a gradient than a binary yes or no.
Mm-hmm. I mean, the seasonal flu, of course, was something that hit all of us. And I think each year there was something like 40 to 60,000 deaths from the seasonal flu. So, we didn't wear masks and we went in big crowds. So again, I think it's what you said about how much risk are you willing to take, because you wind up with FOGO, right? Fear of going out, almost, an agoraphobia, fear of leaving your house. So, I mean, I guess it's for each of us to decide.
And I will shamelessly plug that influenza does have an antiviral that is very effective if taken within 72 hours of symptom onset. So if you feel crummy and you've tested negative for COVID, and reach out to your PCP and see if you need to be treated for influenza, because there is an effective treatment for that.
There's the question, I think, Jared and Lauren, you have this sheet with this very long question about somebody who was worried that the test that they received wasn't adequate or wasn't done properly. Any thoughts on that? They said that they were told that the swab wasn't put up their nose far enough. The only time I ever had a test, they just sort of swabbed the inside of my nose, and that was all they did. Mm-hmm. Same as what this person was saying.
Yeah, so there are a lot of different types of tests, and just because they don't, just because it doesn't feel like they're tickling your brain, like people will say, some of those, it feels like they're not actually, to be clear, when the ones that they're talking about there, it's actually going through your nose into your throat, which is, I don't know if that's better than going into your brain, but they're not necessarily any better than a test where they just sort of tickle the outside of your nose. And so if you're in the particular question that you're referring to here, the person was in a healthcare setting, was given very clear instructions on how to do the test. It's the same thing if you're doing a home test and the instructions are telling you that you go up no more than 3/4 of an inch, just do what it says. Trust that if you're following the instructions, it's a valid test. There are a lot of different types of tests, a lot of different types of samples that can be used to test for the virus, and making it hurt is not going to make it any more valid.
That's good. Yeah, and back to the new, that plagues have been with humanity since there's been congregations, population concentrations. So it sort of comes with the territory, and I guess it's sort of a culmination of everything we've been saying. You know, your willingness to take risks, what level that's at, take advantage of testing and what medicines are being developed. Other than that, I mean, I think all of us want to get back to living what we used to call normal. Do you think it will? Will it ever be quite the same? That's maybe not an epidemiologist question.
I think it's safe to say, and it's okay to say, that we don't know.
Yeah.
We have an entity out there that wasn't out there before. So there is no going back to the same with that regard, especially with public health, because we'll be dealing with it, right? We're dealing with a virus that does change. So the mechanism in which it replicates, it makes mistakes. And so sometimes the mistakes are better for the virus, meaning it makes it more transmissible, it increases disease severity. Sometimes the changes that it makes when it replicates are better for humans. And that is all kind of, it's guesswork. We can't say what'll happen. But we do know that as the virus replicates more in an individual, there's more opportunities for it to change. And that's what we don't want. And that's why vaccination is very important, and staying up to date on your vaccinations, because you don't want those viral loads to be replicating as much. You want to curtail that as much as possible. So decreasing the amount of replication in an individual is very important in trying to decrease the amount of mutations that happen.
That was all of our questions. I wonder if there's anybody in our group that has some more questions or want to relate any of their experiences. How many people have had COVID? Can they get, if you feel comfortable, if that's not too personal? Jared has, and that's it. Sam, you have? You have, you're muted. You're muted. You're muted.
I wanted to ask another question.
Sure, good.
Now that many of our cases are diagnosed and they take place at home, and there's no doctors involved at all, and we're hearing are you guys picking up any of those numbers? And is public health missing a whole lot of cases? And do we as civilians have some obligation to the public health to let them know that we've been ill and have recovered?
So I think that's an excellent question. I would take the energy that you feel behind, you know, what are my obligations, and put that towards, if you do test positive, notifying your contacts, and making sure that they're aware that they may have been exposed, and that, you know, that they can stay home or get tested. You can call us or send us an email at cd@oakgov.com if you do have a positive home test, and we'll put it in our system. But what I will say is the home test reports get included as what's called a suspect case. So they won't end up being included in the case totals, just because we don't have a way of verifying them. So it's not to say don't tell us. If you tell us, it will be put in our system. We'll have that data. But if you only have enough time for 3 phone calls in the day, save one of them for a contact rather than calling us is probably what I would say there. And so to answer your question, yes, we are missing, and we know we are missing, a huge swath of positive cases that people are learning about at home. I would say the benefit of those home tests probably outweighs the issue of us not having that information, because I would much rather the person who's positive have that information than me have that information, you know, even as a public health professional, as an epidemiologist. Obviously, I wish I had perfect data, but I wish even more that everyone who's positive has easy access to that information, so they can stay home and keep their family and friends safe.
And I don't know if Peter brought up the concept of contact tracing, and we're not hearing much about contact tracing anymore. And did that question get answered, or did we skip past it?
I think we skipped past it a little. We don't see it very much anymore.
Yeah, you're right. It has decreased. It's been more focused on high risk groups. There wasn't as much return, so to speak, on contact tracing efforts. So right now, as someone that's just in the general population, if you were to test positive, like Lauren was saying, the best thing that you can do is let them know, right? Let your close contacts know, hey, I've tested positive. This is what is recommended. There is a level of individual responsibility that also needs to happen to help prevent infection from spreading.
And is that being publicized much? Because I mean, I don't, it's common sense, but nonetheless, I don't hear that out there in the media.
I don't know. I don't know that answer. Lauren, I don't know if you've
I
seen
know
it.
that it's in the works. So the state of Michigan has officially discontinued what we call universal case investigation and contact tracing. So early on in the pandemic, the goal was every single person who tests positive gets a phone call. They report their contacts. Every single one of their contacts get a phone call. It has been a long time since we've had the capacity to do that. And it's also been a long time since people picked up their phones when they saw that we were calling. A lot of people are not interested in talking to us. We do still, in Oakland County right now, we are still making an effort to conduct what we call case investigations. So that's you've tested positive, you get a call from the health department, we ask you questions about where you've been. We're focusing on high risk populations right now. It changes. As of right this moment, it's people who are age 55 and older, as well as people who are younger than 4, or who are 4 or younger. So 4 and younger age group are unvaccinated, likely to have unvaccinated contacts. 55 and older, potentially higher risk, likely to have higher risk contacts. But again, that leaves the majority of the population will not be getting a phone call. And I can't say that as of tomorrow, whether that's still going to be the same, because things change quickly. And so, yeah, there does need to be a focus on personal responsibility, notifying people if you do test positive. It's something that the state of Michigan, I believe, is working on messaging. They've said that they're going to be putting some of the effort that was going towards more of that individual outreach and trying to put it towards educating the community. Instead, partly the idea is that is going to go a longer way, that if we can, do the work to really educate people so they know what to do if they test positive, how to notify people, that will, hopefully lead to a larger number of people being notified than the thousands of people who were not answering their phone when they got a call from the state or from us.
Yeah, Dawn, you're muted.
Thank you for joining us. I have a question about the positive and negative results of tests and how sometimes they can be wrong. You can have a false positive or a positive negative. How do we interpret that information with the home test? I did receive mine last Monday. I got it right away, but I haven't felt like I needed to take a test. But I feel like sometimes I've heard the tests they're not 100%, which I understand, but how do we interpret that? If we're feeling crummy and we know we're sick with something, and then we test negative, but we still think it is, what's the protocol there?
Yeah, so Lauren, if you don't mind me, I'll take this one. With that antigen test, that at-home test, it does have a higher probability of having what's called a false negative. That probability increases if you're not symptomatic as well. So if you're feeling crummy, or you feel like you're sick and you've had that negative antigen test, reach out to your primary care physician or seek testing with a PCR test to confirm that result. I recommend reaching out to your primary care physician because there's other tests that can be run, such as for influenza. So if that was the cause of your illness, you would want to get treatment for that. And there is a treatment for that. So That's one of the things that I would recommend.
Okay, thank you.
Yeah, Zig.
I was just going to add one
Yeah.
thing before we get off this topic, which is that the likelihood of a false positive on either a home test or a test that you do in a clinical setting is extremely low. It happens. In a clinical setting, a false positive is usually going to be, it's only going to happen if there's some sort of an error in the lab. They accidentally contaminated the samples or something like that. But the actual, it's not and Jared, correct me if I'm wrong, it's almost impossible for a PCR machine to think it has found the COVID virus genetic material and it actually found something else, unless the genetic material got in there by accident.
Well, the reason I ask is because my client has a family home in Canada, and when they were ready and open to be able to go there, she tested positive. And then a couple days later, she tested negative. So there was some error, and I don't know if there's a timing factor between the first test and the next test, what might happen, but
Yeah,
she could have left to go to her family cottage, but she couldn't because it showed positive, but then when she tested again, it was negative.
So it was probably a true positive, and she probably cleared the virus quickly, which is why it came up negative when she got tested again later. Again, it's possible that those antigen tests, those rapid tests, are more likely to have a false positive, but it's still very, very uncommon. If you do have a positive rapid test that you feel unsure about, you can follow up with a PCR if it's within 48 hours of the initial test. If the PCR is negative and the rapid test was positive, we'll usually go with the PCR and say that was probably a false positive on the rapid. But again, it's very, very uncommon. Generally, if the test thinks it found COVID, it found COVID. But if it's not sure, if it comes out negative, and you're still unsure, you should probably test again, because those tests are much more likely to have, we call it sensitivity and specificity. So the specificity, it's a very specific test to COVID. If it says it found COVID, it probably found COVID, but it's not always as sensitive as it could be. So the sensitivity is how likely is it, if there's COVID out there, how likely is it to find it? And so sometimes the sensitivity, especially on those rapid tests, and especially if you don't have symptoms, can be lower. And that's why, testing again, even if you test again with another rapid test a couple of days later, that's a great way to double check, or getting a PCR.
So a double 48 hours after, and should you be quarantining between that?
Yes.
Yeah. Okay.
Yes.
Within 48 hours. You don't have to wait till 48 hours. I would stress that.
Okay. I didn't know that. Okay. Thank you.
Yeah, Zig.
Anyways, Sylvia doesn't have her picture working, so I'm going to introduce. I'd like to give the floor to Sylvia, but before that, I would like if Jared could explain how he got the virus, he thinks, and him being in the field, what he did, so to give us a couple of pointers. So, but let me introduce you to Sylvia. She's and she's the blank screen. Go ahead, Sylvia. Can you hear us? Unmute yourself. Sylvia? What the heck?
There you go. She's unmuted.
Okay, Sylvia, go ahead and talk. Sylvia, can you talk? Okay, go. I got you on cell phone. Okay, go ahead. Talk on the cell phone. There you go.
Can you hear me, Jake?
Yeah, go ahead and tell. Go ahead.
I just had a couple questions. One question is, what do you do on a plane? What's the best way to keep safe on a plane? And Costco has 5 kits for $40.
How to stay safe on a plane was the one
Okay,
question.
so I think I heard how to stay safe on a plane, and then Costco has, did you say 5 kits for $40? That sounds like a good
Yes,
Yeah.
that's what you said.
Okay.
Okay.
Okay. And
So
okay. Go ahead, you guys, whoever, and then Jared,
Or
maybe you can
Jared,
explain
unless
about
Jared
it.
wanted to tell us his COVID story.
Yeah, let's hear the COVID story then.
But yeah, wait a minute,
Not
hold on
sure-
one second.
Yeah.
Sylvia, could you mute yourself again? We're getting a lot of feedback from your phone. Thank you. Yeah, I'm sorry, Jared, go ahead.
Yeah, so I don't really want to go into that much detail. It was in the very beginning of the pandemic, and you know, all of us were in the workplace. We're all working, and you know, trying our best to keep things from getting out of control at that time. And so that's when I became ill.
Okay. All right. Any more questions?
So as far as the question about flying, I just went to Florida with my family after, and of course we picked like the middle of the Omicron surge after we like had not gone anywhere for 2 years, and almost canceled our trip, but decided to go ahead and do it. My husband and I are both fully vaccinated and boosted. So the first thing, you know, how to stay safe when you're traveling. Number one is if you can get vaccinated, be vaccinated, of course, and be up to date on your vaccines. So that means that if you're eligible for a booster, get your booster. My daughter, who's 4, is she's actually in a vaccine trial. So we hope she's vaccinated. She has a good chance of being vaccinated. She's in the Moderna trial, but we don't know for sure. So we wanted to take, you know, as many precautions as we could. So, you know, we wore our masks all of the time. We had a 4-year-old, so she had to have snacks, but we did the snacks in the airport, and we sat far away from other people while she took her mask off to eat her snacks. And then we were able to fill her up so that for the entire flight, she was able to keep her mask on the whole time. You know, we did the same, kept our masks on while we were on the plane. Once you're actually on the plane, the air filtration is actually excellent. Planes have incredible air filtration. And so you don't have to worry. It feels like, oh my gosh, I'm so close to so many other people. This cannot be a safe environment. And it's certainly not as safe as sitting outside, you know, far away from other people in a park or something like that. But it's not as dangerous as it might feel because the air filtration is excellent. But of course, you want to keep your mask on while you're on the plane. Try and maintain distance from other people. So the higher risk situations are more like when you're in the airport, and you know, you're going to be standing in a lot of lines, and just trying to maintain distance as much as possible. Not, you know, gathering around in like a huddle by the gate when everyone's waiting to get on, trying to be a little bit patient, give people space. But other than that, you know, it's the normal measures that you would take anywhere else. You're washing your hands, you're keeping your mask on, you're maintaining distance, and you're up to date on your vaccines.
Yeah, Sam, you're muted. You're muted.
Okay. I want to advise everybody that the website, the health division's website, the county's website is full of very good information. And I applaud you guys for putting up a very user-friendly and informative site. I found it very helpful and a great resource because it's hard to absorb all this information all at once and hang on to it. So it's a good resource to go back to for further questions. I was reading about a new vaccine that is going to be applied as a nasal spray. And there's a lot of hope that a vaccine in the nasal passages will not only prevent severe disease, but will prevent getting the disease in the first place. Do you guys want to speak to that and your thoughts?
So I'm not familiar. I mean, I'm aware that there are studies underway for nasal vaccines, I think primarily in other countries at this point. as Jared said earlier, I have so much faith in the agencies that are responsible for reviewing the scientific information and making recommendations around vaccines. And so I don't mean this as passing the buck. I mean this with genuine respect for these agencies when I say that if the FDA and the CDC recommend a vaccine, then I would recommend that vaccine. And that's sort of what I would say about that. And unfortunately, I wish I knew enough about like vaccinology to be able to weigh in on whether a vaccine that's nasal administration is going to provide any better or different protection, but I really just don't know.
You two have been so valuable in expanding our, knowledge and information. Yeah, Laura, go ahead.
Well, I was just thinking that too, and wondering if you'd be willing to share how you came to these jobs, what kind of education you had.
Sure, yeah, Jared, do you want to go first?
Yeah, sure. I did my undergraduate at Michigan State University. I studied human biology and then got my master's degree in public health through Michigan State as well. I was initially hired in as an intern at Oakland County Health Division. And then from there, I went over to the environmental health side of things, and I worked with primarily lead, Legionella, and some of our mosquito program. So that was very interesting and good use. And then I got moved over to the communicable disease unit in a week before our first cases. So, and I've been there ever since, and I love it. So.
So my path wasn't quite as like Jared was like on a clear path. I studied environmental studies in undergrad at Wellesley, which is a women's college in Boston, and had a very kind of like liberal artsy background. And then I joined the Peace Corps, and I thought I wanted to do environmental work. It turns out I'm a terrible farmer. I'm a horrible gardener. I've got this one plant behind me. That's a real plant. It's alive. But there are many others that didn't make it. So but while I was in Tanzania, I had the opportunity to work on many HIV related projects and became interested in public health that way. So a little bit later, but still quite, I mean, I was 22, so I wasn't that young. I wasn't that old either. So anyway, I came back and got my master's in public health and epidemiology, but was still interested in sort of that intersection of environment and public health. I worked for the city of Detroit, working on air quality projects and other projects sort of at that intersection of environment and health, pretty much until COVID. And then it was all hands on deck, and I had epidemiology training. And so I transitioned over to working on COVID, even though, full disclosure, I didn't have much of a communicable disease background besides the classes I had taken in grad school. And then came over and started working for Oakland County last October. And it's been a journey, but it's great to answer your guys' question.
My daughter lives in Newton, not far from Wellesley.
Yeah.
So did I miss something? Were you from here originally?
Oh, yes, I should have mentioned that. Yeah, so I grew up in West Bloomfield. And so I moved back to the area to be near family. So this is home, and Oakland County is home. My dad grew up in Oak Park, so your area is also home.
Well, we're glad you're here. Any further questions or any comments? If not, I'm looking around to see if there's any hands raised. Maybe we can just say thanks to both of you so much, and thanks to everybody that attended. This will be recorded. It is being recorded, and we'll be posting it soon enough. And there will be a meeting in March. Maybe one of these days.
Thank you guys for having us.
Even in person.
Yeah.
Thank you all.
And don't
All
forget,
right.
and please
Thank
don't
you.
forget that this might or might not be posted. We still have to get okay from the Oakland County Health Department that this is okay to post. So don't forget that, please.
Yeah.
Thank everyone very much. This has been very informative, very good meeting.
Yes, thank you.
Yeah.
Okay, good.
All right. Bye, everyone. Have a good night.
I wonder though, could
Thank you.
Dawn and Sam and Zig just stay? We're talk about when we're gonna have our next meeting. Anybody else is willing
Everyone's
to.
welcome to stay, but
Yeah, everyone's welcome, but you will be bored. I would suggest doing something else, and it'll just take
we need more
minute.
people involved. Even
Yeah.
if you're bored, please join us.
So no one responded about when we would have our next administrators meeting. Sam suggested Tuesday. At what time, Sam?
7.
7. Okay. I've got a Zoom meeting at 4, but yeah, that's good. I could do it.
And anybody else who wants to be part of the admin team, we're, looking for people to join us and to create new content for our future meetings. Hint, hint,
What happened to Consetta?
nudge, nudge.
Oh, I'm sorry, Consetta, you're there too. My apologies.
I can't make it on Tuesday, but if you guys could let me know what you came up with, I'll think of like ideas to share, but I can't make it on Tuesday.
Can you make it on Wednesday?
Wednesday. I don't know. I don't know yet.
I have a Zoom meeting at 8 o'clock on Wednesday.
And let's stick with Tuesday.
Does that work for you, Dawn?
Either one was my offering.
Yeah, Zig? Okay.
Are the Christians interested in joining us? A recap of the meeting we just attended and then planning for the next meeting.
Sure.
Cool. All right.
Do we have
So
a
you guys have like a family name there, but what are your individual names?
I'm Christine, so it's like Christine without the R.
And I'm Chris.
Okay. Awesome.
Okay.
Cindy, are you interested?
Interested, but
Okay, good.
I'm in the periphery, on
Well,
the outskirts.
you know what? It's all about, just helping the neighborhood out
Yeah.
and coming up with
Yeah.
some ideas and reaching out to different entities to come to our meeting. And the epidemiologists were here because of Charlie Cavell, and I'm not sure who reached out to him. Was that you, Sam?
Yeah.
Yeah.
Good job.
So
Mhm.
sometimes it's just, making some calls and just making, the mayor was supposed to be here tonight and she wasn't. So
Yeah.
I'm actually kind of glad because we ran out of time.
Yeah.
It worked out perfect, but that's another part of the planning, like trying to fit some of this ask the mayor into the meeting, 'cause I think that draws some people in when they have serious questions about what's going on in the neighborhoods.
But what I did like about this meeting, I know you've done a couple other meetings, is when you send out the questions ahead of time or ask for questions, and then you post the questions, and then to give people more of an idea. And
I think an involvement too. Everybody's frozen.
So we're hooked for Tuesday at 7 p.m. via Zoom,
This is 8 o'clock, right?
7 o'clock.
I'm sorry, the 8th of February.
Yes.
Yeah, right. Okay. Imagine me still writing things down. Old school. Okay.
Thank you, Peter.
Thank you,
Thank you.
everybody.
It was a great meeting.
Thank
you just-
you.
Thank you.
Yeah.
You just take a selfie of yourself, Dawn?
I am taking pictures of the chat in case we lose it.
Oh, good idea.
Sam, are you raising your hand?
No, I'm trying to leave.
All right. We'll see you all soon.
Hey,
Bye-bye.
thank you.
Bye.
Bye
Come
for
out and
now.
enjoy the snow.
Hey, Zig,
Hey,
do you cross country ski?
yes, I was about to go today, and then last minute I decided to go for a walk instead. But you?
Yeah, do you want to go tomorrow?
Yeah, I think so. What's tomorrow? Tomorrow? Yeah,
Tomorrow's
very
Friday.
likely. When do you have time?
Well, Peter and I, and maybe Laura, the neighbor, Laura, something Russbaum,
Okay. Oh no, Rosenbaum?
Rosenbaum, yeah.
Oh, I know her. Yeah, well,
Yeah, she might join us too.
Is this for cross country?
Yeah, cross country. Do you have skis?
Yeah, I got my own skis. Where are you talking to go?
We are gonna leave here at 11:30 and go out to Proud Lake.
Oh, God, that sounds great.
Have fun, you guys.
Yeah. Oh, yeah.
Concetta,
Sure.
do you want to join us?
I wish I could. Took today off. I'm going back in tomorrow. Back into work.
Aw, bummer.
I don't have my cross country skis anymore. I just kind of like gave up because we never get any snow.
I know. Well, Peter and I have been planning this for days because we knew the snow was coming in some form or fashion. We didn't think it was going to be 12 inches, but we thought we both have Friday off. We're going to go. If you have your skis, you're more than welcome to join us and come with us.
They rent skis out there. That's Havener Canoe Rental. They have them.
It is, but I don't think they're really actively renting anything out there right now. You
Okay.
know, but if
They
you
have to
have,
pass. But
but if you have your own skis
yeah, well, I have my own skis. Yeah.
for cross country,
Yeah. Oh, downhill and cross country. I also go down. I also go downhill. I went on Tuesday.
I saw your picture.
Oh yeah. After that last snow, it was I have a great time.
I love downhill, but tomorrow is cross country, so if you want to go and join
Yeah.
us,
How are we gonna? Who's driving what?
I'll drive and we'll just meet here at 11:30. We're gonna want to take off at 11:30 and get there, do like an hour, maybe an hour and a half, but definitely like an hour, 30 minutes in, 30 minutes out. Maybe it takes us a little longer, but no longer than that.
So I'll be the four of us then if I go.
If you go, yeah. And Laura will join us if she doesn't have skis, so she's talking about jogging with us.
Yeah, well, I know Laura. She's a great friend, but don't count on anything.
I know, I hear ya. But does anybody, do you have cross country skis she could borrow?
No, I don't. I
Okay.
got size 11. That's my foot size.
Concetta, do you have skis?
I don't. I used to have like snowshoes, and snowshoes would be good too. But
I
they
have
got all
I have
made
snowshoes
up.
I offered to her, so we'll see what happens.
Yeah, so that'll be fun.
Yeah. Well, I wish
All
you
right.
could join
Well,
us.
we're supposed to have a Starbucks with a friend of ours tomorrow, but there's no certain time yet. And besides that, they're in Indiana, and I just texted them, and they said they're not sure when they're even back. So they might. I think we're going to be back by 4:00, I suppose. Or
Absolutely.
oh, wait.
I have to pick someone up at the airport tomorrow at 5:15, 5:30. So we're not staying long out there. We're just gonna go out and go through the woods. It's so beautiful. The trees are huge and tall. It's where I grew up. I learned how to ski and canoe out there.
Oh yeah, Proud Lake. Me too. I've been out there.
It's my home, my childhood home.
I love it too. No. There are. It's about with snow. It could be an hour getting out there. You know, it could be 45 minutes. Don't forget, right? So.
I'm figuring 40 minutes
Okay, so I mean,
and if we leave at 11:30, we're not in rush hour.
Yeah, those 12:30, skate for hour to
Hour
1:30.
and some change.
Be back by 3 or at least or
Yeah.
2:30.
Right. Yep.
Yeah. Okay. I got another. I'm doing tomorrow. This is I mean, I'd like to play with you guys sometime, but I play Rummy Cube too. So we're playing with Cheryl, my wife, and I. We're going to play with our neighbors. Actually, I wish they would join the Zoom sometime. They're new in the neighborhood, and I did give stickers to everybody, but I don't think and they really hardly speak English. They're Mexicans, and they're so nice.
Well, maybe just send them a link to join.
Yeah. Yeah. Why not? Do that? Okay, I should have thought of that.
If you have an email or a text, you can just send it.
Well, I did give everybody a sticker on my whole block on both sides. So, but
well,
anyway, yeah. Let me put that into my. I'll put that in pencil for now. 11:30. You're leaving, though, right? Okay.
Yeah, we can meet here at 11:15, 11:30.
I just wanted to make a comment about our neighborhood. I came home yesterday and my walkways were all shoveled.
Wow.
Yeah, my neighbor across the street. And then the guys that live behind me, they came by and they plowed it again with their snow blower. And I went, God, who is that? And the guys behind me they went down the block on Woodside. And then my neighbor next door shoveled today for me. So it was so nice. I mean, I can really
Yeah. Well, obviously you've got a lot of fans.
Well, it's like you give and you take. I'm always asking people if they need anything at the store or just
right.
Like I've given gifts to them and things like that. So if I have things that I'm getting rid of, I'll ask Michelle if she wants something.
That's good. That's how life should be. People should give, and then if God forbid you need, somebody should step up. But don't count on it. Don't count on it, but it would be nice.
Because that one kid he's 17 and he's making a lot of money, like out there, like shoveling people's snow, and he's going to charge $50. And I said, well, my neighbor already shoveled. So I guess I saved myself some money. So, but it was nice.
That's good. It's good to hear that. That's good to hear that people are nice.
It's good to be neighborly.
It is.
I mean, going back, last year I did this almost the same thing. Oh, I knew one guy was out of town in Florida.
Yeah.
I went all the way from my house all the way to the corner. I did the whole sidewalk, except that one neighbor who's in Florida, and he's a nice guy, a friend of mine. I specifically also did his approach to the steps.
Yeah.
So another neighbor who's also, say, a friend of mine, complained to me that I didn't do his approach.
See, you're playing favorites, Zig. You can't win.
You can't win. So, I got chewed out by this guy for helping this guy.
Where was Lester tonight?
I don't even know.
Where was the mayor? She was a no-show.
Well, with this weather and, who knows?
It's Zoom. She doesn't have to go anywhere.
She could have had a frozen line, Comcast line,
Maybe. I don't know. But I'm glad we didn't put it in the post, but it was something Peter just asked her last night and she said yes. It wasn't like it was weeks ago.
Yeah. Well, she may have, who knows? She could have not written it down.
Well, hopefully everything's okay.
Yeah.
She has a husband who's not well, I think, and hopefully everything's okay.
I could text her right now and say hi. We missed you at the meeting. Hope everything's. Me and two people were just wondering how she is.
Yeah, you could. Sure.
Okay, hang tight.
I'm sure Peter's texted her too, because he was the one that invited her. But I had said to the epidemiologist, maybe we'll let the mayor go first, and then the mayor never showed. And then they really, I think all those questions were going to take up an hour, but it did.
Okay.
Yeah, it was a good meeting.
It was good to see some new faces.
Yeah.
Is it
All right.
Marianne or Miriam? How do you really spell her name?
It's Marion with an N at the end.
M-A-R-I-N?
And
M-A-R-I-N?
uh-huh,
A-R-I-A.
Marion.
Yeah.
Okay, hold on, hold tight. Hi, Marianne, it's Zig, and we got a few people on and Consetta. We're hoping everything is okay. We did miss you at the meeting, that's all. How are you? Okay, here's us. Hi, Marianne, it's, oops,
Marion.
Miriam. Yeah.
You have always called her Marianne.
Yeah, I know.
It's Marion.
Marion. Marion.
Oh my God, I'm still recording. Stop.